During this webinar, cold plunge therapy is our focus here, and you'll discover an introduction to cold plunge therapy, the health benefits of cold plunge. The cold plunge may combat symptoms of chronic disease, scientific evidence and studies, and how to integrate cold plunges into your routine. A sneak peek of the benefits of cold plunge therapy that will be unveiled: reduced inflammation, pain management, boosted metabolism, better quality sleep, cognitive benefits, enhanced muscle recovery, stress relief, and improved mental health, improved circulation, and enhanced immune function. The origins of cold plunge therapy. You guys ready for this? Okay, so cold plunge therapy, also known as water immersion or cryotherapy, has ancient roots and has been practiced for in various cultures and throughout history. The therapeutic use of cold water dates back thousands of years and can be traced to several key historical and cultural origins. Ancient Greece and Rome. Greeks and Romans incorporated cold water immersion into their bathing routines to promote health and well-being. In Nordic cultures, in Nordic countries, especially Finland, alternating between hot saunas and cold water plunges has been a long traditional practice. And then traditional Chinese medicine used cold therapies to balance the body's energy and improve health. Indigenous practices, various indigenous cultures have used cold water immersion for healing purposes, often combining it with natural therapies in combination. And then cold plunge in modern revival has been used and gained renewed scientific benefit, or all the scientific research has really brought the world together to go deeper, and the recognition that this is received has been based on robust scientific data. And so you'll see it here with Dr. Henning Saupe, a renowned medical professional, an MD with a holistic cancer focus. He's going to share with you the benefits here. And these are doctors that are using this therapeutically for their most severe cancer patients and people wanting to prevent cancer. So it's very important. Check this out.
That would be mitochondrial therapy, cold plunge, and that uses the principle of hormesis. That's a technical word, a Greek word, to describe the mechanism behind a therapy like cold plunge. It means hormesis is to use a meaningful stimulus to get a good body response as the consequence of the stimulus. So the stimulus is a cold plunge. Wow, we cool down the body artificially, and what that does is it stimulates the production of new healthy mitochondria, and it stimulates the death of and the elimination of compromised, aged mitochondria. The mitochondria have their own genes, they have their own cell cycle, they have their own life cycle. So what cold plunge does, as other biohacking strategies like PEMF, pulsed electromagnetic frequency therapy, or hydrogen therapies with hydrogenized water or the inhalation of hydrogen, is to stimulate a growth of new mitochondria and the elimination of used, aged, dysfunctional mitochondria. That is hormesis, meaningful stimulus.
So, as you can see there, the reason why top cancer doctors are using this is because it's tapping into important functions of the body. So cold plunge therapy stimulates vasoconstriction and vasodilation, mechanisms of vasoconstriction, cold exposure. When the body is immersed in cold water, the cold temperature stimulates the sympathetic nervous system, which triggers the contraction of smooth muscle cells in the walls of blood vessels. This leads to the narrowing of the blood vessels, which is vasoconstriction. Reduced blood flow. Vasoconstriction decreases the diameter of blood vessels, which reduces the volume of blood flowing through the peripheral areas like skin and extremities. This helps conserve core body temperature by redirecting blood flow to vital organs. Heat retention. By stimulating or by limiting blood flow to the skin and extremities, the body minimizes heat loss and maintains core temperature. This response is an adaptive mechanism to prevent hypothermia in cold environments. Summary. In cold plunge therapy, vasoconstriction helps reduce inflammation, swelling, and muscle soreness while conserving body heat. Following cold exposure, the body's natural warming process causes blood vessels to dilate, which further aids in recovery and improves circulation. The mechanism of vasodilation: increased blood flow. Vasodilation increases the diameter of blood vessels, allowing a greater volume of blood to flow through the previously constricted areas like the skin and muscles. This enhanced blood flow helps to restore normal circulation. Heat dissipation. As the body warms up, vasodilation helps dissipate the excess heat generated, promoting a stable internal temperature and aiding in the removal of metabolic waste products. Summary: in cold plunge therapy, vasodilation enhances blood flow, supports muscle recovery, improves circulation, and helps remove metabolic waste products. It plays a vital role in rebalancing the body's thermal state and promoting overall health and recovery. Enhance immune function. So here's the study: health effects of voluntary exposure to cold water, a continuing subject of debate. Ice bathing is often claimed to offer numerous health benefits, such as boosting the immune system, treating depression, enhancing circulation, increasing libido, burning calories, and reducing stress. The review found that some studies suggest that regular cold exposure might help treat chronic autoimmune inflammation, reduce high cholesterol by activating brown adipose tissue, and improve stress regulation. These studies suggest that regular cold exposure can be effective in treatment of chronic autoimmune inflammation, reduce hypercholesterolemia by brown adipose tissue activation, and have a positive effect on stress regulation. Here's the studies. So you'll find that we're referencing the studies. Every word is precise and specific according to what is proven and what is not proven. And that is why this is such a fascinating exploration, because we have science that is backing this up. So enhanced immune function continued. Study immune system of cold exposed and cold adapted humans. The objective of this study was to determine if a non-infectious stimulus such as cold water immersion can activate the human immune system and improve overall physiological status. After 6 weeks of repeated immersions, trends showed higher plasma levels of IL-6 and increased amounts of total T lymphocytes CD3, T helper cells CD4, T suppressor cells CD8, activated T and B lymphocytes HLA-DR, along with a decrease in alpha-1 antitrypsin. Conclusion: the study concluded that repeated cold water immersion, a stress-inducing non-infectious stimulus, highly activates the immune system by increasing metabolic rate and catecholamine levels due to shivering. And here's the study here. Here are the cardiovascular benefits. Study: could human cold adaptation decrease the risk of cardiovascular disease? The study compared 10 cold-adapted winter swimmers with 16 non-adapted controls to see how cold adaptation affects various health markers. The key findings were lipoprotein metabolism. The CA group had a lower ApoB and ApoA1 ratio, indicating improved lipoprotein balance. Homocysteine levels were lower in the CA group. Thyroid hormones, the CA group had higher levels of triiodothyronine, which is T3, but other thyroid hormones were similar between the groups. And then the antioxidant defense, the CA group had a lower GPX1 activity and reduced concentrations of oxidative stress markers, CD, but higher PON1 activity. Catalase activity tended to be lower, though not significantly. Zinc concentrations were higher in the CA group. And here are the studies here. And we know how important zinc is. So continued, in summary, cold adaptation was associated with better lipoprotein balance, lower homocysteine, and some changes in antioxidant and thyroid hormone levels. And the conclusion was overall cold adaptation appears to influence oxidative stress markers and may have a positive trend on cardiovascular risk factors in cold adapted individuals. Cardiovascular benefits continued. Study the effects of cold exposure, cold water immersion, whole and partial body cryostimulation on cardiovascular and cardiac autonomic control responses in healthy individuals, a systemic review, meta-analysis, and meta-regression. In the review, 24 articles were included. The findings revealed significant improvements in heart rate variability following the cold exposure, including increased RMSSD, RR intervals, and high-frequency HF components. Additionally, there was a notable decrease in low-frequency components and the LF-HF ratio, with these changes persisting for up to 15 minutes after exposure. Our meta-analysis suggests that cryostimulation and or CWI exposure enhance parasympathetic nervous activity. And here is the study referencing. And here is Dr. Daryl Joffrey to explain this mechanism. And he's a physician working specifically with patients with all kinds of chronic issues, autoimmune, cancer, etc.
The cold plunge is amazing because, again, it stimulates your detox pathways, helps your mitochondria, helps reset your microbiome, improves your brown adipose tissue. So it's actually improving the fat in your body. So those are some typical morning biohacking things that I like to do. Cold plunging is very powerful. So I'll ideally do my workout. And then what I'll do is I'll do the cold plunge. Now, if I don't have a cold plunge, what I'll do is I'll do a cold shower. Not quite as effective.
Yeah. So there's a difference. And you'll see this as we go into the presentation. You'll find of why certain levels activate certain processes in the body and why certain temperatures are therapeutic to help with various functions of the body positively, and how they work to combat negative problems, symptoms, diseases, etc. Weight management. Study 2 key temporally distinguishable molecular and cellular components of white adipose tissue browning during cold acclimation. Converting white adipose tissue into brown adipose tissue could be crucial for combating obesity. To understand long-term potential of white adipose tissue to function like brown adipose tissue, researchers studied the browning of retroperitoneal WAT in rats over 45 days of cold acclimation. The conclusion was that cold exposure induces browning in all types of RPWAT cells, not just beige ones, as previously thought. However, only a few cells that change early during cold exposure maintain a brown-like state long term. Most revert to their original state. Thus, WAT browning has 2 phases: an initial widespread but temporary change in many cells, and 2, the long-term retention of a few brown-like cells. Both phases are important for body weight regulation and the effectiveness of anti-obesity treatments. And here's the study. Here, the thermogenic metabolism in brown adipose tissue. Here's the study: brown fat mediated tumor suppression by cold altered global metabolism. This study demonstrates that exposing tumor bearing mice to this study demonstrates that exposing tumor bearing mice to cold significantly inhibits the growth of various solid tumors, including hard to treat cancers like, guess which disease? Pancreatic cancer. It doesn't get more scary than that for most people, a pancreatic cancer diagnosis. And to know that there are tools that interface directly with this disease process is incredibly, encouraging and hopeful. So, conclusion: in a preliminary human study, so not an animal study, mild cold exposure activated significant brown adipose tissue in both healthy individuals and a cancer patient, leading to reduced glucose uptake in tumor size. These findings introduce a novel approach for cancer therapy using cold exposure and BAT activation, either alone or in combination with other treatments, as a potential strategy for effective cancer treatment. Here's a study from nature.com. Here's the bone health effects. Here's the study: effects of an exercise program and cold water immersion recovery in patients with rheumatoid arthritis, feasibility study. This study aimed to evaluate the feasibility, acceptability, safety, and effectiveness of an individualized intermittent exercise program followed by cold water immersion as a recovery method for rheumatoid arthritis patients. 18 RA patients, one man with an average of 55 years and body mass index of 25.5 kilograms per millimeter squared, indicated in the program 3 times a week. The study assessed outcomes before and after 9 and 17 sessions. Results showed high acceptability with no patient dropping out or experiencing difficulties or pain. Significant improvements were observed in heart rate and the PWV after 9 sessions. The program was found to be acceptable, safe, and effective, suggesting it could be adapted for supervised home use. And here's the study. The blood flow effects. 9 men were immersed in 8 Celsius or 22 Celsius water. And so the study was influence of cold water immersion on limb and cutaneous blood flow at rest. Results: immersion at 8 degrees Celsius, 64.4 Fahrenheit. Water led to a greater decrease or decreases in rectal temperature at 0.2 Celsius and thigh skin temperature 6.2 Celsius compared to 22 Celsius or 71.6 Fahrenheit water. After immersion, femoral artery blood flow decreased similarly in both temperatures. However, thigh skin blood vessel constriction was less during and after immersion in 8 Celsius water compared to 22 Celsius. Conclusion: the study found that immersion in both cold and warm water led to similar overall blood flow in the limbs. However, colder water directed more blood to the skin, potentially reducing blood flow to the muscles. This reduced muscle blood flow might help explain why cold water immersion is effective in reducing muscle damage after exercise. And here's the study here. Here we have a prolific expert, a dear friend, Dr. Brian Ardis, explain why cold plunge therapy is so effective in disease remediation, including with the process of inflammation. And he explains this in regard to something that everyone is familiar with. When you have an issue with pain or burn or bruising, what are you going to put on it? Ice. Okay. So what does that do in your body? He's going to discuss this.
So cold plunges, yes. Cryotherapy, beautiful way to reduce inflammation in the entire body. And anybody out there that thinks this is a bad idea, the majority of human beings in America are dealing with an inflammatory condition. This is why most elderly are being given steroids. Steroids are anti-inflammatory. Well, what does ice do to an inflamed part of the body? If you sprained your ankle, what are you going to do with it? It's going to swell up with inflammation, and what are you going to do to reverse it? You're going to put ice on it. Your medical doctor or physical trainer is going to put ice on it immediately. Ice helps to reduce inflammation, and then it helps your body excrete those inflammatory markers from your blood through your urine, your bowels, and your sweat. And then your body will bring new fresh blood to continue the healing. This is how cryotherapy and cold plunge therapy can be beneficial. So using those intermittently is a beautiful way to encourage and speed up the process of healing and reversing inflammation in the body. Cryotherapy just happens to be your whole body, up to your neck. Cold plunges is typically up to your neck too. So cryotherapy and cold plunge therapies are beautiful therapeutics for speeding up the healing process.
All right, let's continue. Okay, let me just, I'll go over a little review here. So you're going to see a little catch up here. And so some of the powerful things there, have you thought about that? Have you thought about what it looks like to take a practice that you've learned about as a child? Who has bumped their head? Can anyone have a memory of falling over, bumping your head, having your mom or your dad sit there with ice over your head, and remember how immediate it was that it took away pain, and it helped the healing process. And without it, you would have had a much more difficult process. Does anyone remember this process? Has anyone had this happen to them recently? Have you had a burn and you applied ice to it, and that application not only helped in the immediate relief, but it also helped in the healing long term. And as a result of doing that therapy, that may have been done in the initial time and was not done then after, but because you did that and you were willing to apply that there for that 15 minutes or the 30 minutes after the exposure or the initial aggravation, the initial assault, the bruising, the burn, as a result of having completed that process originally, the healing was much better long term. It didn't present issues. It actually healed properly versus present issues throughout your life. And these are things to consider. Okay, so having a look here with muscle soreness. So here in this study, cold water immersion cryotherapy for preventing and treating muscle soreness after exercise. Bleakley C. 2012, Cochrane Library. A review of 17 small trials with 366 participants found that cold water immersion generally reduced muscle soreness compared to passive interventions, with significant effects observed at 24, 48, 72, and 96 hours after exercise. Cold water immersion also led to lower fatigue and potentially better physical recovery immediately after treatment. So is fatigue important to anyone here? Would you like to have more energy? Do you feel that you battle with fatigue? And if that's the case, then how can you combat the chronic life-threatening diseases that are prevalent that we have a high statistical likelihood of getting? And how is that exacerbated with low energy, low voltage, low functioning of our whole body as it is needed for all its functions? All of a sudden, we are dealing with so much, with so little to come up against those toxic threats, the inflammatory processes that are in our body. The fatigue is such an important aspect of understanding where the disease problem really can originate from. So conclusion, there was some significant evidence or some evidence that cold water immersion reduces delayed onset muscle soreness after exercise compared with passive interventions involving rest or no intervention. And here you have the study backing this finding. Study, cold water immersion enhances recovery of submaximal muscle function after resistance exercise. A study with 10 active men compared the effects of cold water immersion and active recovery low intensity cycling after high intensity resistance exercise. Participants did a resistance workout and then either immersed in 10 degrees Celsius or 50 degrees Fahrenheit water for 10 minutes or cycled at low intensity for the same time. The key findings here were submaximal muscle function. Participants lifted more weight in the final sets of squats after CWI compared to active recovery. Muscle temperature decreased by about 7 degrees Celsius, 44.6 degrees Fahrenheit during CWI and remained lower than pre-exercise values for 35 minutes. Blood marker CWI reduced blood oxygen levels for 1.5 hours and increased plasma IL-6 levels while decreasing plasma myoglobin levels compared to active recovery. Here's the study here referencing this and continued. Overall, CWI did not improve maximal muscle function, but allowed for better performance in submaximal exercises, suggesting it could help with longer-term training benefits by allowing athletes to work harder in subsequent sessions. Study, can water temperature and immersion time influence the effect of cold water immersion on muscle soreness? A systemic review and meta-analysis. A review of 9 studies found that cold water immersion was more effective than passive recovery for both immediate and delayed recovery. The best results were achieved with water temperatures between 10 and 15 degrees Celsius and immersion times of 10 to 15 minutes. Specifically, temperatures in this range and immersion durations led to better immediate and delayed recovery compared to passive recovery. The conclusion was that the available evidence suggests that CWI can be slightly better than passive recovery in the management of muscle soreness. The results also demonstrated the presence of a dose-response relationship, indicating that CWI with a water temperature of between 11 to 15 degrees Celsius and an immersion time of 11 to 15 minutes can provide the best results. Here is the study here. Fatigue and performance study effects of cold water immersion after exercise on fatigue recovery and exercise performance, meta-analysis PMC. That's PubMed. Okay, so this systemic review, which includes a meta-analysis of 20 studies from 2002 to 2022, examines the impact of CWI on fatigue recovery and exercise performance. The key findings were that CWI significantly reduced delayed onset muscle soreness and perceived exertion immediately after exercise. It also decreased counter movement jump performance immediately after immersion and lowered creatine kinase levels at 24 hours and lactate levels at 24 and 48 hours. The review recommends that athletes use CWI immediately after exercise to effectively reduce muscle soreness and accelerate fatigue recovery. Okay, here you have the study. Here's Dr. Ben Edwards.
Another recent addition in our clinic is cold plunge, and a lot of it had to do with energy production, which obviously that's what I've been talking about the whole time, cellular energy production, but the overall fatigue of the body. When someone subjectively reports they feel fatigued and tired, that tells me their cells are not making energy either, not just globally, they're tired. And so that's what we've seen with the cold plunge is overall energy production's up. Mood, it's had a calming effect. Sleep, people sleep deeper and better. They recover. You know, this is more the fitness and workout folks seem to recover well. But a lot of the benefit we've seen from cold plunge has more to do with, I believe, kind of hormone signaling and neurotransmitter signaling, as we see a much more calming effect, better sleep, and better mood, overall energy production too. Things like red light therapy and cold plunge have been very, very beneficial modalities. And really, guys, what we're trying to do is just bring as much to the table for the body to support the body's natural healing mechanisms.
That's what it's all about. Supporting the body's healing mechanisms. It's that simple. And hence why this is being used for all different kinds of chronic conditions, from fatigue to mental health, which we're going to cover now, to pancreatic cancer, to all different forms of cancer, autoimmune conditions, thyroid conditions. And that's really exciting to know that something can be so universal in its application. So certainly I would wager that cold plunge therapy is one of the most universal antidotes that we have in the world. So mental health is a rising concern, to say the least. And I know what this is like. My wife has battled anxiety, depression, PTSD, and ADHD, and she has been in extreme levels of these. So we know what it's like to battle these challenges. She obviously knows firsthand. I know secondhand from being married to somebody that has battled these conditions and the ripple effect of that and how it does affect our lives. And people know what that's like. And so having remedies available that put these conditions at bay or put them in remission, put them, reverse them systemically, or make them completely manageable. These are things that have a life-changing impact. So anxiety affects approximately 284 million people worldwide. These are very conservative estimations. I think that the estimates are probably 10 times higher, but this is more like looking at clinical observations. So they're very conservative. It could be argued that even more than half the world, which would be talking about a few billion people battling anxiety. And same would be true in a similar fashion for depression. This is just my projections on what I see as being quite global and systemic issues in practically all people. Or the other way I could argue this as well is that all people deal with degrees of anxiety and depression. If you do not battle with these in any way, shape, or form, let me know in the comments, because you would certainly be an anomaly. And so how do we make these conditions better? How do we make these symptoms better? Because they're not actually technically even diseases. And I would argue that for all cases, they should be more referred to as symptoms that are caused by certain factors. toxins being one of those, and various mechanisms of the body being off, trauma and other factors are contributing to these, and the real reasons why they exist. But the depression impacts around 264 million individuals. Been, again, extremely conservative numbers. 32.9% of US adults face both mental health conditions and substance abuse, and that can even be certainly drugs, alcohol, but a lot of us are easily medicating ourselves with other substances, whether it's excessive amounts of caffeine or excessive amounts of addictive food behaviors. These are certainly addictions that sugar cravings. These are huge when it comes to substance abuse and actually addictive behaviors that are crippling for people. Brain health. Here's a study. Short-term head out, whole body cold water immersion facilitates positive effect and increases interaction between large scale brain networks. 33 healthy adults experienced with cold water swimming and underwent a 5-minute whole body bath in 20 degrees Celsius water. Brain connectivity and emotional states were measured before and after immersion. Participants reported feeling more active, alert, proud, and inspired, and less distressed and nervous afterward. The improved positive emotions were linked to changes in brain connectivity between areas involved in attention, emotion, and self-regulation. Conclusion. Overall, short-term cold water immersion appears to positively impact brain function and mood. Isn't that good news? Here's the study here on the government database, PubMed. Health impacts here. So this is mental health benefits for cold plunge therapy. So study cardiovascular and mood responses to an acute bout of cold water immersion. Cold water immersion may offer physical and mental health benefits. In a study with 16 healthy adults, the effects of a 15-minute CWI at 50 degrees Fahrenheit and 10 degrees Celsius on vascular shear stress and mood were examined. Participants' effects were assessed before, 30 minutes after, and 180 minutes after immersion. Total and antegrade shear stress, along with oscillatory shear index, were reduced 30 minutes post-immersion, and cortisol levels were lower 180 minutes after immersion. The conclusion, in summary, a single bout of cold water immersion has a minor impact on shear stress patterns, but may improve mental health by reducing negative emotions and lowering cortisol levels. Here we have the findings here. Study open water swimming as a treatment for major depressive disorder. A 24-year-old woman who had experienced major depressive disorder and anxiety since the age of 17 years old had not responded to treatments with fluoxetine and citalopram. Citalopram. After giving birth to her daughter, she sought to be both medication-free and symptom-free. She began a regimen of weekly cold water swimming, which led to an immediate improvement in mood after each session and a gradual sustained reduction in depressive symptoms. This improvement allowed her to reduce and eventually stop her medication. At a 1-year follow-up, she remained free of medication. This is in the British Medical Journal. Isn't that amazing? These are great studies. Menstrual and perimenopausal effects. Study, how do women feel cold water swimming affects their menstrual and perimenopausal symptoms? This study aimed to determine how women felt cold water swimming affected their menstrual and perimenopausal symptoms. The results were these. In a survey of 1,114 women, so that's not a small group, it's a big group, cold water swimming was reported to alleviate menstrual symptoms. Amazing, right? Particularly physiological ones like anxiety, 46.7%, mood swings, 37.7%, and irritability, 37.6%. Perimenopausal women experienced significant improvements in anxiety, 46.9%, mood swings, 34.5%, low mood, 31.1%, and hot flushes, 30.3%. Many women swam specifically to address these symptoms, 56.4% for menstrual issues and 63.3% for perimenopausal symptoms. Participants attributed their symptom relief to the physical and mental benefits of cold water. Here's a study. And here we have Dr. Saeed Haider, who's going to share some of the results that he has observed clinically from this therapy.
I started the cold plunges, just hearing that they were, good for, a biohacking method, good for immunity, good for, weight loss, good for all kinds of things, good for raising your, dopamine, baseline dopamine levels. A lot of people, unfortunately, in the modern world have suppressed their baseline dopamine levels dramatically, and they probably need to go on a dopamine diet, avoid like things that trigger these little dopamine rushes, all the time, like using your phone and checking your email every 3 seconds and, checking your social media and, all that stuff. So part of, healing from all of that, all this like chronic stimulation and overstimulation is, it can be doing cold plunges. And so chronic low dopamine levels will give you a lack of motivation, right? You just don't feel like doing anything. And a lack of focus too, right? A lack of clarity and focus. And, a lot of the ADD, especially on the margins, is probably due to just this chronic, dopamine overload all the time. But the point is that I really think that this is a very underappreciated modality of healing. Some people notice benefits within a few weeks. With the cold plunge, I noticed benefits right away. It was like the shock to the system. It was really fast, almost like a stellate ganglion block kind of thing for me, like just hitting the reset button.
Who wants to hit the reset button when it comes to their health, their mood, their everything when it comes to what are the symptoms that you're experiencing? Would you like to hit reset and to get a fresh start and to be able to experience life again? So look at these temperatures here. So 55 degrees so this is Fahrenheit to 65 Fahrenheit, 12.5 to 18.3 Celsius. And so because this temperature isn't quite as low, then you could do up to 40 minutes in this temperature. Okay, so the benefit here is stress reduction and focus. Then you've got 50 to 55 Fahrenheit, which is 10 to 12.5 Celsius. So this 10 to 20 minutes, and this is optimal post-workout cooling. Then you've got 45 to 50 degrees Fahrenheit, or here you've got 7.8 to 10 degrees Celsius. And now this is 1 to 3 minutes, and this is recovery, inflammation, reduction. So this is working systemically across the board, autoimmune disease, cancer. These are all diseases that are connected to this inflammatory process. And then you have a look at now this next level. So 35 to 45 degrees Fahrenheit, 1.7 to 7.2 degrees Celsius. Now this is just 30 seconds, only 30 seconds to a minute. So just 30 seconds to a minute. Imagine that, just only 30 seconds. Okay, so that's kind of how long it takes to drink a cup of water as a 30-second time period. But the benefit here, the dopamine increases by 250%. So how does that change the mood? Incorporating cold water therapy into your daily routine can offer numerous benefits, including soothing muscle soreness, building resilience, enhancing metabolism, aiding weight loss, strengthening hair and skin, supporting the immune system, boosting energy levels, promoting better sleep, and improving mood and mental health. And the benefits of sauna blanket and cold plunge in a combination therapy. Now we're looking at putting therapies together. So one is heat and the other one is cool. Why would we do this? So increased blood flow. Sauna blankets use heat to promote vasodilation, widening of blood vessels, which enhances circulation and supports muscle recovery after cold plunge therapy. Detoxification, the sweating induced by a sauna blanket can help eliminate toxins from the body through the skin. Relaxation and comfort. The heat from a sauna blanket can provide soothing relief and help relax muscles, making it a comfortable follow-up to cold plunge therapy. And then muscle relaxation. The heat helps relax muscles and can reduce muscle stiffness and soreness. Why should I use the sauna and why do I use it in combination? Let's have a look. So starting with a sauna prepares the body for a beneficial thermal contrast routine. In the sauna, your body temperature rises, causing blood vessels to dilate and sweat glands to activate. This process promotes detoxification by eliminating toxins through sweat and enhances circulation, delivering oxygen and nutrients more efficiently throughout the body. Transitioning from the sauna to a cold plunge, where temperatures range from 50 to 59 degrees Fahrenheit, 10 to 15 degrees Celsius, triggers a rapid constriction of blood vessels. This shift, known as thermal contrast hydrotherapy, activates the body's fight or flight response, increasing adrenaline, heart rate, and circulation. The cold plunge also reduces inflammation and helps remove metabolic waste. Combining the sauna with a cold plunge leverages the contrasting effects of heat and cold to stimulate and invigorate the body, ultimately enhancing overall wellness and well-being. Our recommendation: starting cold plunging can be invigorating and beneficial, but it's important to approach it with care to avoid potential risks. Here are some key safety recommendations for starting cold plunge practices. Medical clearance: consult a healthcare practitioner or provider, especially if you have cardiovascular issues, respiratory conditions, or other medical concerns. Gradual introduction: start slowly. Begin with shorter durations and less temperatures to allow the body to acclimate. Gradually increase the time spent and temperature as your tolerance improves. Know your limits. Listen to your body. Pay attention to how your body responds. If you feel dizzy, excessively cold, or uncomfortable, exit the plunge immediately. Avoid overexposure. Limit your time in the cold plunge to prevent hypothermia. Typically 1 to 3 minutes is sufficient for most people. Proper preparation: warm up your body before plunging with light exercise or warm-up activities. Hydrate. Ensure that you're well hydrated before entering cold water, as hydration or dehydration specifically can increase the risk of adverse effects. Safe environment. Supervision: if you're new to cold plunging, it's helpful to have someone nearby in case of an emergency. Non-slip surface: ensure the area around the plunge is dry and free of hazards to prevent slips and falls. So, for example, if you're doing cold plunge for the first, or one of the first few times you're doing it, it's easy to have somebody around to just make sure. But then you get used to it, and you're fine. It becomes a part of your normal routine, and there's no concerns there. So that supervision is really just for people starting, or if you feel that you're particularly frail or for some reason of that nature. But again, this can all be mitigated by simply not putting the temperature as cold, so that you can make sure that your body is adapting, and then you will have the confidence to do it at the most optimal cold temperatures, and using devices which we're going to share with you more. They can get to these lower temperatures that are the most effective for all kinds of disease reversal, and to alleviate all kinds of inflammation, and help with the mental function, etc., etc. Post plunge care: warm up gradually. After exiting the cold plunge, warm up gradually with dry clothes, a warm drink, or a warm shower. Rewarm properly. Avoid hot showers immediately after the plunge, as it can cause a shock to your system. Gradual warming is safer. Understand the risks: hypothermia. Be aware of the symptoms of hypothermia, including intense shivering, confusion, and slurred speech. Cardiovascular stress: cold plunges can stress the cardiovascular system, which can be risky for individuals with heart conditions. Choose appropriate water temperature. Aim for water temperature that is cold but manageable, typically between 50 degrees Fahrenheit to 59 degrees Fahrenheit, and 10 degrees Celsius and 15 degrees Celsius. Extreme cold can be harmful. Alleviate your wellness routine with the Embrace Portable Cold Plunge Tub and Plunge Life Chiller. And so it's designed for ease and convenience. This portable bath allows you to enjoy the invigorating benefits of cold water immersion anytime, anywhere. It's perfect for recovery, relaxation, and revitalization, and it's your go-to solution for a refreshing plunge. Crafted with premium components comparable to those of higher price brands, the Plunge Life Portable Cold Plunge Tub epitomizes both excellence and accessibility. Featuring top-tier military-grade drop stitch inflatable technology, it stands strong against any weather and seamlessly integrates into your dynamic routine. Enjoy and embrace, get ready to embrace the invigorating and revitalizing effects of cold plunge therapy. Are you ready for that? Enhance your wellness journey with the Plunge Life Cold Plunge Tub. So check this out. And so what sets our Plunge Life devices apart? So the convenient inflatable design, quickly inflate and set up your Plunge Life tub in minutes, whether at home or in the backyard. After use, it deflates easily for compact storage, or keep it inflated, simple, in a place that it can be easily stored. Either way is easy to do. Advanced chiller system. The Plunge Life chiller keeps your water at ideal cold temperature for effective recovery sessions. Durable and comfortable, crafted from high quality, puncture resistant materials. Our inflatable Plunge Life tub is built to last and provides a comfortable and supportive experience for users of all sizes.